Well, as the measles outbreak continues to spread in the United States, Health Secretary Robert Kennedy Jr. has taken to social media to endorse the use of the standard MMR vaccine. That's despite having a history of skepticism over their use. This comes after a second child with measles died in Texas, where hundreds of cases have been reported. Dr. Peter Leary is the president of the Center for Science in the Public Interest and joins us now from Washington, D.C. Peter, good to have you with us in the early hours of the morning where you are. Now, firstly, how bad is this measles outbreak and how far might it spread?
Well, it's pretty bad by our standards. In the United States, we consider measles to have been eliminated back in 2000. That doesn't mean that there's literally no cases at all, but we haven't seen an outbreak of this magnitude for quite a while now. So it's quite concerning. There's no sign that it's coming to an end. It seems to be moving into additional states.
Yes, and do we know how it began? This coming at a time when the disease was supposed to have been eradicated in the U.S.
Well, we have a declining rate of vaccination in this country, including for measles. And there is a community out in this particular part of Texas, a Mennonite community, where vaccination rates may well be lower. Certainly, the children are often homeschooled, and that means that they're not subject to any requirement to be vaccinated in order to attend. So the understanding is that the vaccination rates were low. The measles virus came from wherever it did, and it's taken advantage of this low vaccination rate.
Yes, and at this stage, are the relevant health agencies, both state and federal, getting on top of this current outbreak?
Well, what we've really seen are a bunch of mixed messages from the new federal government. We've heard Secretary Kennedy most recently making a comment about how vaccination is the way to go. But the fact is, he's spent the last 10 or 20 years undermining exactly that. And I'm afraid that the message has actually gotten through. And so that's a part of why we have declining vaccination rates. So we've got mixed messages from him. Whenever perhaps with the exception of the very last pronouncement, every time you get a statement that says, I'm good with measles vaccine, you get some qualifier. You get, well, yes, but the vaccine may be, every bit as dangerous as the disease. You get, well, actually, it's better to be naturally infected than to get immunity from the vaccine. Or you could treat yourself with steroids or vitamin A, cod liver oil, implying that would be just as good. So all of these things undermine the confidence in the vaccine, and we think aren't helping at all.
Yes, and of course, talking about the health secretary there, why do you think, he did a bit of an about face? Is it because of his position as health secretary to begin with?
Well, I certainly hope that, common sense in the medical world is finally getting through to him. We'll see if it really continues. Like I say, we've heard isolated statements from him before. This is his Twitter account, not him himself. So it remains to be seen how it all plays out. But in the meantime, we're subject to massive cutbacks in the health departments over here in the United States, and that's not going to make it any easier to quash this outbreak.
Yes, Dr. Leary, I wanted to bring up this tweet from Health Secretary Kennedy. He has been in Texas visiting some families of the victims who died as well. But this is where he sort of credits two doctors for healing hundreds of measles-stricken children using clarithromycin and budesonide. So can I get your thoughts on those comments?
Yeah, well, again, this is a good example of him, in effect, downplaying the vaccine by claiming that it will be easy to treat this disease. I mean, try telling that to, the two children who have died, right? And ironically, having played at least some distant role in their deaths, there he is at the funeral, showing his compassion. It's just extraordinary, the whole situation. But really, that's what that is. Clarithromycin, budesonide, one's an antibiotic, which in fact is not active against measles because it's a virus. The other is a steroid not usually used in the treatment of measles. But the real point here is not to treat measles well when it happens. The real point is to prevent it. And that's where the vaccine comes in.
And now we are seeing, you've spoken about this just a short time ago, vitamin A. We are seeing that even health facilities in Texas are now having to treat children for toxic levels of vitamin A in their system, something that RFK Jr. has recommended to treat measles. Has there ever been a scientific basis for something like vitamin A?
Well, it's a little complicated because probably these people who are taking vitamin A at high doses and winding up in the hospital or being treated as a result are people who are taking it to prevent measles infection. If there's any evidence for vitamin A in measles, it's in the treatment of measles infection. But really, then it's mostly in countries where there's large amounts of malnourishment, an actual vitamin deficiency. In a situation like that, vitamin A is a useful thing to administer. It's not clear that it has any role whatsoever in the treatment of people in the United States.
Yes. And Dr. Leary, if in a situation where a large proportion of a community has been impacted by measles and that they're largely do not believe in taking vaccines, how does a particular health authority contain this particular an outbreak like this?
Well, there's really one simple way. It's called vaccination. And what they ought to be doing is sending a group of people from the federal government or along with the state health officials into the affected area and starting to identify unvaccinated people and vaccinating them. That's how you put an end to this.
Yes, and have things been made more difficult by cuts to the federal health department by the Trump administration?
Without question. I mean, partly there are people who are getting laid off, but the other part of it is just the complete chaos in terms of the way that they've implemented these cuts. People literally don't know from day to day whether they'll have a job, and it's just not possible to adequately plan an emergency response in a context like that.
Yes, and just on another note, the Health Secretary Kennedy, he's also wanting the CDC, the Center for Disease Control and Prevention, to stop recommending fluoride be added to drinking water supplies. Utah has become the first state to do so. What might be the impacts of such a decision, and could more states follow suit?
Well, I think there's probably a good chance that additional states will follow suit. That seems to be the pattern. We do have concerns about that. Fluoride is one of the great public health accomplishments of the previous century. It's probably true that the need for fluoride has diminished over time as people's diets have changed, and particularly as people have managed to get fluoride from toothpaste, for example. So it may be a little bit less needed than before. Accordingly, the American government actually changed its recommendations with respect to the levels of fluoride that it recommends. It lowered them, in public drinking water. So they've already taken that into account. But for the secretary, there may be a glimmer of a point that he has, but it's tied up in the usual conspiracy theories. And so it's hard to know really on what basis he's recommending it, other than that somebody told him it was a good idea.
Okay, Dr. Peter Leary, really appreciate your thoughts and your insights. Thank you so much.
Thank you for having me.